video is part 4 in our nerve entrapment series. I'm going to be covering the suprascapular nerve, the function of it, where it gets caught, why it gets caught, clinical signs of an entrapment of it, and mostly important, how to actually fix it. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning and long-lasting pain relief. I'm also the creator of the 𝐓𝐡𝐞 method and the founder of the soft tissue treatment revolution, where we teach overworked massage therapists a better treatment system that will allow you to cut your treatment times by at least 50% so you can stay healthy, avoid the dreaded burnout, and help a hell of a lot more people get out of pain. All right, so nerve entrapments part 4. If you haven't watched part 1, 2, or 3, I will link it up top if you're watching it on YouTube. If not anywhere else, I will put it down in the comment sections below. Each one's kind of building up on each lesson as we go. I think I'm going to do about 12 or 13 of these total, but this week we're going to be covering the suprascapular nerve. So let's get into it. So the function of the suprascapular nerve. It is a mixed nerve, basically meaning it does both motor and sensory. Yeah, nerves can do 2 jobs, which is pretty cool. The motor part is it helps to move the infraspinatus and the supraspinatus of the rotator cuff. If you don't know the 4 muscles of the rotator cuff, infra, supra, teres minor, and subscap. This one controls 2 of them. The one on the back part of the shoulder blade and right above that on the spine of the scapula. It also does sensory input. What is sensory input? Gives the brain and the spinal cord an idea of what's going on, specifically in the shoulder and the AC joint. So it kind of just gives some feedback about what's going on in a more sensory type of environment. So where does the nerve get stuck? It gets caught in a couple different areas, but the main place where it comes is this is called the suprascapular notch. So this whole nerve here where I'm showing, that's the suprascapular nerve, and it can get caught in a couple places. First, it just gets caught right up in the supraspinatus as it gets stuck in there as well. And it can also get caught deep underneath, right on top of the infraspinatus as well. It also gets caught a little higher up in the nerve roots. I'm going to cover that a little bit more in the training. You can also see a little bit of it getting caught out in the lateral part of the infraspinatus as it goes out in the shoulder, but there's a bunch of areas where it can get caught, but mostly in that supra or that infra as it's going its way down into the shoulder. So why does it get stuck? I've been talking about this every week. Poor and sustained posture, people sitting, looking down, not moving enough. And basically over time, muscles get overworked. They don't get enough blood flow. They don't get enough oxygen. Body sends a signal to the brain and says, hey, something's going on here. Brain sends back some collagen, starts to form it. Not good collagen builds up over time, bigger and bigger and bigger. Eventually, that scar tissue gets bigger, gets caught to the nerve, numbness, aching, burning, tension, all that stuff, and causes some issues. I also see some issues in there with the nerve. If there's been a history of dislocations of the shoulder or separations, because as it's like that trauma goes through, it can cause some issues in there and pull that nerve and create more of that scar tissue as well. Common injuries associated with an entrapment, definitely rotator cuff injuries, because if there's a problem with the motor function of the suprascapular nerve, there's going to be problems with the supraspinatus and the infraspinatus. Also just going to be some sensation issues overall in there. Another one we're going to see is a C5, C6 nerve root issue. I covered this in the last training where I went through the C4 nerve entrapment. I did C5 nerve entrapment getting caught between C4, C5. Well, this one can actually get caught in the C5, C6, which is actually going to be the C6 nerve root. And this can cause some issues higher up in the scalenes. Shoulder bursitis. Shoulder bursitis is usually just a bullshit term for there's some swelling in the shoulder. They really don't know why, but a lot of times that swelling and that inflammation is occurring because there's scar tissue buildup in the muscle, in the nerve, all around there. When that happens, the body's trying to buffer it with inflammation. So the bursitis is the effect, but it's not the actual cause. Definitely shoulder separations and dislocations like we talked about. If that shoulder gets rocked back and it yanks that nerve, can cause some issues in there as well. And then some brachial plexus injuries as well, as it kind of comes down and makes its way on the front part of the armpit. If there's some dysfunction a little bit further up there in the brachial plexus, it can kind of alter the mechanics of the nerve and where it goes. A lot of times if it's caught down in the armpit, in through the pec and down by the clavicle, it can actually pull a little bit higher up there. So a problem further down can cause some issues a little higher up. So how to find it? Use landmarks. Landmarks are really important. Slow down. Don't be in a rush to just want to jump right in there, but you have a really awesome landmark to find this one. So this big bone that goes across the back of the body, that is called the spine of the scapula. If you go about dead center in between, you're going to find that suprascapular notch. And as you find that, that's going to be right up and through here in the middle part. And then pretty much dead center through the infraspinatus as well. It's going to be right there underneath the spine of the scapula. So here's the thing. There's not a lot of tissue in between the nerves and the muscles there. You know, supra is right on top. There is some trap over top there that can block it a little bit, but a lot of the infraspinatus is really just, you got some skin, a little bit of subcutaneous fat, then you go right on the infra. So a lot of times it's a lot easier to find it in the infra than it is in the supraspinatus. Sorry. Kind of zoned out there for a second. So how to effectively treat it? Talk about this all the time. Slow, precise, and focused. Yeah, it's very, very important to go slow, precise, and focused. So what we need to address is, first you need to address it at the source. So there's a couple different ways in the anatomy variation. Some say that it can be the C5, some say it can be the C6. I would check both. I covered that in our last training video where I went through the scalenes, but first we need to clean it up at the nerve root where it starts. And usually I'll go on the C5 first and then try C6. And sometimes I might hit C4, but mostly it's going to be 5 or 6, depending on what you feel. And you get in there and you palpate. You feel correctly as you go. Where that entrapment is usually going to occur is going to be between the posterior and the middle scalenes. Then the next area we're going to go in there and treat it is going to be at that suprascapular notch right above there into the supraspinatus. And then lastly, we're going to go below into the scapula, below the spine of the scapula. That's going to be the infraspinatus. So we kind of want to see where it's getting caught in all different areas as we go. I like to start higher at the root source, like in the nerve as well, especially if there hasn't been a lot of history of trauma. I'm thinking overuse and it's working its way down. And when you treat it, you need proper depth, then tension, then you feel the tissue slide. So many treatments out there, myofascial release, ART, all these things. You just go in and you're beating the living hell out of the tissue. You're not actually getting proper depth and tension. That what you have to do is you have to find it, put it in a shortened position, butt up right against that nerve, get some depth in there, back out, set some tension. Then the client goes through a full range of motion as you're applying tension, but not more depth. Don't be more compressive. The nerves are very superficial. They're very sensitive and they don't want to be treated, over-treated. You know, so many people will go in there and beat the living hell out of it. If you're using your elbow, you're a jackass. I talk about this every week. Don't be a jackass. Use your hands, feel, use your thumbs, be very precise. You don't need to kick the living shit out of the tissue because it's going to cause more problems. And you never really want to do more than 3 to 5 passes per entrapment. So say you find one at 5, 6, 3 to 5 passes. Maybe you find one down low at 6, 7, 3 to 5 passes. Then you go in there and clean it up in the suprascapular notch, 3 to 5 passes. Then below that into the infraspinatus, 3 to 5 passes. That's it. All in all, you should be doing about 15 or 20 minutes of total work. And that still includes like your palpation, finding it, slowing down, all that. You don't need to do all this extra work and just beat the living shit out of it, because treatment is like a medication. You get enough to be effective, but if you overtreat it, you're going to have big issues in there. That's all I got for this week's training. You know, one thing you can do is you can go and download and access our free training modules. I believe they are better than most paid courses out there. And what we do in that training module is we're always evolving them and putting new ones out there. We're teaching how to specifically hone in on one problem, learn how to effectively treat it, how to fix it, how to find it, and get you on the path to being more of what I call a solutions provider versus a service provider. I appreciate you guys watching this video, and we will see you on the next one.